Good afternoon, everybody. I'm Liz Charlotte, Director of Communications at the Mississippi State Department of Health. We have a lot to discuss today, so let's introduce our panel. State Health Officer Dr. Thomas Dobbs is joining us, along with State Epidemiologist Dr. Paul Byers and Senior Deputy and Director of Health Protection, Mr. Jim Craig. Dr. Dobbs, I want to start with you and talk about the low uptake of vaccines right now. I know some questions may be regarding safety that we're calling hesitancy, but some of it may be some complacency. So how do we get eligible Mississippians to go get their vaccines?
Thank you, Liz, and thank you everybody for joining us today. You know, we're at an important part of the pandemic. We have made great improvements in the number of cases and deaths, but we're at a plateau at the moment. We're continuing to see ongoing cases. We're seeing some outbreaks now, especially with concerns about the evolving and increasing Delta variant, which is more contagious and potentially more deadly than previous strains that we've seen. But we do have an effective vaccine that's very effective at protecting folks, but also preventing transmission. And it does have retained efficacy against these variants that we find to be so difficult. Mississippi is struggling at the bottom of the country with total vaccination. We do have some variable bits of success in that we have immunized approximately, or at least initiated immunization on approximately 76% of everybody over 65, which is important. That's our most vulnerable group. But that still means we have almost a quarter of 65 and older folks who are unvaccinated. So first and foremost, we really need to make sure that we protect vulnerable folks. So if you're over 65 or if you're over 50 and have any medical issue, you have got to be vaccinated. We know that you're very likely either to get the vaccine or COVID, and under every scenario, getting the vaccine is the right choice. It's effective, it's safe, it saves lives, and it prevents transmission. So please get vaccinated. We are lagging in younger age groups, and that's one of the things that's going to cause us a lot of difficulty as we go into the fall and as the variants continue to spread. And the challenge with that's going to be is we're going to have ongoing outbreaks, and I think Dr. Byers is going to talk about that in these unvaccinated groups that are going to do several things. It's going to impede our ability to open up schools fully without having to go through quarantine and close off events and that sort of stuff. But it's going to further threaten those vulnerable groups because we're maintaining transmission. We know that people who are vulnerable are going to catch it from somebody, whether it's a family member or somebody in the community. We know that people who have severe medical issues or immunosuppressed, transplant patients, cancer patients will not respond as well to the vaccine, and they may remain vulnerable even after being vaccinated. So it's important for us as a community to protect one another to get as many people vaccinated as possible. As we think about some of our most vulnerable folks, we know that there is great vulnerability with the nursing home setting. We know that those folks are older, they have a lot of chronic medical issues, and we've seen a great number of deaths across the country, but also within Mississippi. And being in a congregate setting, we know that outbreaks can happen fast and furious. So we are doing a real big effort to make sure we protect our elderly folks or our residents of long-term care settings and nursing homes. And we are increasing our testing regimen for those folks for people who are not vaccinated. So stay tuned. We're watching this very closely, and we know that these new variants are going to be a specific threat for these groups of folks. We know that some folks are reticent about getting vaccinated. A lot of that is because I think a thought process that it doesn't affect me. We've been through the worst pandemic in over a century. We've lost over 600,000 Americans. It's now the third leading cause of death in this country. And we have an opportunity, we have an exit door. And too many of us are not choosing to use that door. And when we don't all use it together in a sufficient number, it keeps us all vulnerable. It keeps us vulnerable as individuals. We are seeing increasing number of cases and deaths in our 40-year-old folks. And it also leaves our communities vulnerable. So it's no time for apathy. It's time to understand that the real benefit of the vaccine is going to be not only to protect you, but also to get us back to more normal operations as far as our daily lives and the economy. And we know that it's safe and effective. And the further we go into this, we understand the benefits. There is some new information out there that CDC revealed on the rare myocarditis, especially for young males, but it's extremely rare. We're looking at about 12 per million, and it seems to be to me, really pretty mild. Keep in mind that COVID causes myocarditis at a rate far higher than that. So we need to make sure that we keep things in perspective. Are there going to be some folks who have some rare, potentially sort of allergic type reactions? Just like with any medication, things are going to happen at some frequency. Fortunately, it's extremely rare, and it seems like that these myocarditis resolves quickly. But when we compare it to the real known threats for all of these things, that COVID is the wrong pathway. Getting COVID is the wrong way to go. And we have an effective way to prevent not only individual people from getting it, but also from spreading within our community. That's all I have, Liz. Thank you.
Thank you, Dr. Dobbs. Let's go to Dr. Byers. And Dr. Byers, why don't you start with giving us an update on the numbers?
Absolutely, Liz, and thank you all for the opportunity to be here to once again talk about COVID and the importance of vaccine and what we're seeing from an epidemiological standpoint as well. If we look at our vaccination numbers, as Dr. Dobbs talked about, we do have the lowest rates in the country. We have vaccinated with at least one dose 33% of our population in Mississippi, about 30% of our total population fully vaccinated. And that's compared to the rates nationally, where we're looking at over 53% of Americans have at least initiated the vaccine with one dose, and over 40, close to 46% of the population has been fully vaccinated. So we are seeing some lag in Mississippi. We do have some places in Mississippi that have done well. We have a number of counties that are over 40% of their county population have initiated the vaccine, and a number of those have fully vaccinated 40% of their county as well. So, we're getting good buy-in in areas, but it's not uniform across Mississippi. When we look at what our cases are doing, today, we're reporting out an additional 118 cases, but no deaths. But when we look at sort of the dynamics that we're seeing in our deaths, in our hospitalizations, in our cases, what we're starting to see is a bit of an increased proportion of cases and deaths among our younger population. Last week we had a number of deaths that were reported out in individuals who were in their 40s and late 30s. And these were unvaccinated individuals. But when we look at the majority of our deaths right now, they're still occurring in people over the age of 50, largely over the age of 65. And although, like Dr. Dobbs said, we have vaccinated at least 75% of our folks over the age of 65 with at least one dose, which is great, we still have a large proportion of our folks in that very vulnerable age group have not gotten vaccinated. And that's where we are seeing many of the deaths. So we are still seeing deaths in our older, vulnerable population who have not been fully vaccinated. And a lot of that occurs from the transmission that we're seeing in younger folks. We still are seeing some lags in our younger folks with uptake of vaccine. In our 12 to 15-year-old age range, our 17 to 18-year-old age range, we are seeing cases. And now we are seeing cases of the Delta variant, which is the variant we've talked about that is increasing nationally. We're seeing more cases of the Delta variant throughout the United States. And now we are seeing increased cases in Mississippi. We're up to 29 cases that we've identified due to the Delta variant. By and large, these are in central Mississippi. We're seeing the lion's share in Hinds County, in Madison. We've seen some other counties as well. I would invite y'all to look at our website, and we do have that data on our website about where we're identifying those variants. But the cases that we're seeing are in unvaccinated younger people that is resulting in secondary and tertiary transmission. And although these people by and large are going to recover and have no long-term complications, they can serve as the source of transmission for those older folks or the more vulnerable population where there can be increased hospitalizations, there can be deaths. And so, it's incumbent upon all of us to make sure that we are doing our part to, when we get vaccinated ourselves, not only are we protecting ourselves from infection, not only are we protecting ourselves from variant strains, but we're also protecting those individuals that we come in contact with. 65 and older folks don't live in a vacuum. They interact with all age groups. And so, we have certainly seen increased variant strains being identified in Mississippi. Our surveillance is ongoing, but we want to continue to make sure that we get as many folks vaccinated as possible. So when we talk about variant strains, we've seen a number in Mississippi. Still, by and large, the most significant one that we've seen is the UK variant or the Alpha variant. This is a more infectious variant. It is more easily transmitted. Certainly, it has the potential to cause a more severe infection and lead to more hospitalizations and deaths. And in some cases, the monoclonal antibodies that are used to treat it as an outpatient are not as effective. Well, we're seeing the same thing with the Delta variant. It is even more infectious than the UK variant strain. And because of that increased infectiousness, not only can it be transmitted to those individuals who are unvaccinated, but it can also be transmitted to folks who are fully vaccinated, who may not be completely protected from the vaccine, or may be in congregate settings where their exposure rises to a higher level. So again, I want to encourage everybody to do their part. I want to also ask you, look at the website for the data that we have on the county vaccination rates. We have the list of the counties that have achieved over 40% of initiating that first dose and over 40% of complete vaccination. But we want all counties to rise to that same level, and we need to continue our efforts even further on. So, I'm gonna, I think, stop right there, Liz and Dr. Dobbs and Mr. Craig, and we'll let y'all go from there.
So thanks, Dr. Byers. Just a few updates today. In Mississippi, there really is no reason not to get tested for COVID if you have symptoms or concerned about being a potential contact to a case. COVID testing as well as COVID vaccinations are available free throughout the state of Mississippi. To assist in testing and vaccination efforts, the health department has recruited partners across the state to provide COVID testing and vaccination. Most of these partners include folks like health systems, facilities that participate in our COVID Center of Excellence program, hospitals, federally qualified health centers, clinics, pharmacies. There's just a number of people that are part of the battle to try to make sure that we get COVID opportunities available throughout the state for Mississippians. You may now also get your COVID vaccine at 28 of our county health departments, and we hope to have it available at more county health departments in the coming weeks, so stay tuned on that. I'm going to share a little map. This is one of the planning tools that we use as we look to develop pop-up locations. I'm going to talk a few minutes about pop-up locations. So this is a vaccine equity planner. It's done as a joint center project with Brigham and Women's Hospital and the Harvard T.H. Chan School of Public Health. But what you see in tan here are areas of opportunity, because those are areas where we have some high social vulnerability, and those are based on CDC's Social Vulnerability Index. But it's more than 15 minutes drive to the closest active COVID-19 vaccination site. So as we work to develop pop-up locations around the state, this is one of the things that we factor in to make sure that when we work with local officials and churches and others, that we try to bring vaccine closer and closer to where people live, work, and play. So let me provide a kind of a brief update on COVID testing for a minute. Our capital city COVID testing location at the farmers market continues to provide free COVID testing Monday through Saturday. We also have 25 locations in the state, as you can see depicted on the map here, that provide free COVID testing. And these are in front of county health departments, except for Benton County. Benton County, we don't have a health department in Benton County. So testing's been arranged at the Benton County Agriculture Center. That's on Highway 5 over in Ashland. But all of these locations provide free testing. Now, these locations in front of health departments were picked because in the rest of the state, other clinics and partners had identified that they were providing free testing. So this is, again, us trying to fill gaps in those areas where more testing was necessary, especially free testing available to Mississippians. So testing is open to everyone with or without a appointment. To reduce waiting, though, you may want to schedule a test, provide some information about your symptoms. You can do that by either calling 601-496-7200 between 8 and 5 Monday through Saturday, or complete the UMC COVID online patient screening form that can be found at covidschedule.umc.edu. For those that come to the test locations, you should remain in your car while you're being tested. So when we look at testing, who should take advantage of this opportunity? Well, obviously anyone that takes care of the elderly, anyone working around students, especially the students that haven't been vaccinated yet, students, anyone with symptoms, remembering that the symptoms may appear 2 to 14 days after exposure to the virus, but those symptoms include fever, chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, a new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. Again, those testing locations are out there around the state to provide quick results on whether or not COVID is your diagnosis. My next update is really about the COVID vaccination pop-up sites. We talked a little bit about the planning tool that we use. In looking at the map today, those that you see in pink are counties that we've already visited and provided first and second doses in kind of a town-to-town way of providing vaccination opportunities. Those that you see in green are some of our current sites, and we'll talk a little bit more about some of those current sites here in a minute. And then those in blue are counties that have reached out to the health department to continue additional vaccination efforts in their particular counties. And we're working with those counties to identify venues, again, as we bring vaccine closer to where people live, work, and play. So we'll continue to work with these local government officials, church leaders, healthcare partners to conduct these pop-ups. And pop-up, by definition for us, is really a short-term COVID vaccination site that we do in these select counties. Again, moving from county to county in many areas, or from town to town in many areas. They provide vaccination for anyone 12 years and older. We are using the Pfizer vaccine in these locations. Second doses are usually available in these areas about 3 weeks later. No documentation, identification, or appointment is required at any of these pop-up locations. We also work with the local leaders to set up the site and help in getting the word out to community members. And what I'd like to ask you today, especially our media, is along with the local leaders, help us get the word out, help spread the word about these opportunities. So as we get closer to where people live, work, and play, they can take advantage of these opportunities. We'll take care of the details with the locations to get everything set up and make it as easy as possible to get these opportunities created. So if we look this week at where we are in Jasper County, today and tomorrow, we at the Jasper County Emergency Management Office in Bay Springs. Friday and Saturday, we'll be at the multipurpose building in Heidelberg, Mississippi. Jeff Davis County, today and tomorrow, we're at Bassville at the John Thompson Sports Complex. And Friday and Saturday, we'll be at the Ezra Gardner Memorial Market building in Prentiss, Mississippi. Also in Kemper County, today and tomorrow, or today, we're in East Mississippi Community College in Scuba. And tomorrow we'll be in the Little Rock Community Center in the Little Rock area of DeKalb, Mississippi. Friday and Saturday we'll be at the Farmers Market building in DeKalb. In Webster County next week, we'll be in Eupora at the Eupora Community Center on Wednesday and Thursday, and in Matheson at the Public Library on Friday. In Macon, we will be at the Noxubee County Civic Center, both Wednesday, Thursday, and Friday. And in Raleigh in Smith County, we'll be in the Smith County Agriculture and Civic Complex, Wednesday, Thursday, and Friday of next week. And then the following week, we'll be in Chickasaw County at the Oklahoma City Hall on Wednesday and Thursday, and at the Woodland Town Hall on Friday, and back at the Oklahoma City Hall on Saturday. While we're conducting pop-up locations, and really for anyone who's homebound, as you heard Dr. Dobbs say, that those over 50 with any medical problems or others that may be homebound as well. If you're homebound and need assistance getting your COVID vaccination, we have an email location at covidhomebound@msdh.ms.gov that you can send an email to us and let us know you're ready for vaccination, or just call the COVID hotline 7 days a week between 7 a.m. and 7 p.m. at 877-978-6453. So if we look at our current walk-in locations, these are the state walk-in vaccination locations, the 19 locations around the state. We still are providing Moderna vaccine at Adams and Washington County, and the rest of the sites are Pfizer locations. So they are able to vaccinate 12 and over at those locations. If we look at our county drive-through vaccination sites, we have one county site that's still operating in Montgomery County in Winona on Tuesdays, and their site will end on the 29th of June. So we appreciate all the work done by that team in Winona to bring vaccination to these drive-through locations now for weeks in the Winona and the Montgomery County area. In addition to our pop-up sites, remember, we're still operating those 19 walk-in locations. You will see some changes in those over time. You may have heard the announcement that the Mississippi National Guard will be ending their pandemic support operations on July the 15th. Want to make sure that to acknowledge that just how much we appreciate Major General Bowles and his staff's leadership and the many men and women of the Mississippi Army and Air National Guard for their service. Without a doubt, we could not have achieved much of the success that we've had without them. Their dedicated service included things that were really big issues in the beginning of this pandemic, things like moving PPE or personal protective equipment and other medical supplies to our hospitals and nursing homes and other facilities, as well as county governments around the state, assisting with COVID testing at our health department locations and healthcare facilities, working in our public health laboratory, and helping with COVID case investigations. And as you know, once COVID vaccine was available in Mississippi, these heroes supported our COVID vaccination efforts in our drive-throughs, our state walk-in locations, pop-ups, and special events throughout the state. So many, many thanks to all of those young men and women for their assistance in this pandemic response. But as the Guard winds down, we will continue to increase COVID vaccine availability in our county health departments and seek support of pop-up sites with our various vaccination partners. As identified earlier, we have a lot of partners that are out there helping with the vaccination mission, and we will definitely be in contact with them to see if they will be able to assist us in some of our pop-up locations. Also, by mid-July, many of our county health departments will be armed with that COVID vaccine. So that's my update for today. Liz, I'm going to throw it back to you for any questions we might have.
Thank you, Jim. We do have some questions. So I'm going to start with Josh Carter from WLBT. And Josh, I actually talked to Dr. Dobbs about this just before the press conference. Josh is asking, I have recently learned that vaccinated blood and unvaccinated blood is not being separated at donor sites. Hypothetically, how much of the vaccine would an individual receive if they were given the blood of a vaccinated person? Would they then be considered vaccinated, Dr. Dobbs?
No, definitely not. They might be exposed, getting a small amount of the antibody, not the vaccine per se, right? But the antibody. But no, there wouldn't be enough in there to be effective. The other thing is, most of the antibodies are going to be within the plasma, which is a different thing that you get from red blood cells. But even now we know that plasma, even straight up plasma, is not very useful for treating COVID. So it's probably not going to be protective. So even if you've had a blood transfusion and you're wondering if you might have some immune protection, you really wouldn't. There's really, it's not, there's no theoretical way to think that you would have any sufficient immunity.
Okay, thank you, Dr. Dobbs. Sarah from the Clarion Ledger is asking, what is the highest driving factor behind low lagging vaccination rates in Mississippi at this point? We talked about it a little bit, but Dr. Dobbs, would you like to say anything further?
Yeah, there's a lot that goes into it, and there's different reasons for different folks. I mean, most of the people who were really anxious to get it have already been vaccinated. The majority of our older folks have been vaccinated, but it seems like that there's a significant number of people who are still on the fence. And what we've seen is it takes a good conversation with their doctor to understand what are the factors involved in making that decision. So if you're one of these folks who are still on the fence and haven't decided yet, and you need more information, we strongly encourage you to sit down with your doc and ask the questions that you want to ask. We know that those trusted relationships are the most potent for helping folks understand the true depth of it, because it's complicated. We know some folks have a lot of questions. It's hard to get the detailed information that you want from a TV commercial or a newspaper article. So talk to your doc. The other big issue is a lot of folks don't think it's really relevant to them anymore. Y'all, COVID's not over. We're still going to have problems. If we want to have a successful start to school where people are actually able to stay in school and not be disrupted by quarantines and closures and that sort of thing, we need to have more folks vaccinated to be successful. We've been through a remarkable year, but now we have remarkable tools to fight back. And if we choose not to use those tools, we're going to be the ones paying for it.
Thank you, Dr. Dobbs. Is the department planning on additional outreach to younger people who seem to be getting vaccinated at a lower rate than older residents? What will that look like? We do know that we are going to begin, we have not focused as far as our public health campaigns on that group, and we are beginning a public health campaign that will be mostly digital and YouTube. Dr. Byers, would you like to say anything else about efforts with the younger generation?
Yeah, Liz, and we do, and we want to focus our efforts on young people in a way that they understand, and I think Dr. Dobbs just mentioned a couple of things, and that is that the way forward is to get more back to normal is for us to get vaccinated. That's how we can avoid disruptions in school. That's how we can continue extracurricular activities in both college and in K-12 for those eligible students who are 12 and older, and we're going to roll out additional messaging targeting just those very things. But, another thing that we're looking at now, and we're still in the planning stages on it, is what school-based vaccination clinics for those interested parties will look like. And, we're going to be rolling out in the next couple of weeks or so additional conversations with schools throughout Mississippi to begin that process of what is that going to look like in the fall, and how can we facilitate more on-site vaccinations for children in K-12 who are eligible. Not only do we want to make sure that the message is out there, and just to reiterate, I think Dr. Dobbs is right on target that we need folks to go to their trusted sources, to talk to their provider. That's where people learn to get information, and that's where people feel more comfortable with the validity of that information. But we want to make it easy as well, and we're going to work towards making vaccines available at schools throughout Mississippi, so that that students and those teachers who still haven't gotten vaccinated have all of the opportunities that they need to jump in and join in.
And we're working very hard to strengthen our relationships with providers, because we did a survey, a vaccine trust survey, that showed that most people want to get the vaccine from someone they know or trust. So that's an important effort that's coming up as well. I think Sarah has one other question. Okay, is the increased testing in unvaccinated long-term care residents, is the increased testing in long-term care residents or unvaccinated? The new guidance is for the staff. The new guidance requires staff to either be vaccinated at long-term care facilities or to get tested twice a week.
That's correct.
Dr. Byers, anything to add to that?
No, and it is directed at staff. We know that low vaccination rates among the healthcare workers and staff in long-term care settings can be the point of entry for the virus into the facility and can result in transmission within the facility. We want to do everything that we can to improve the vaccination rates within those long-term care settings. And so staff, we are now either required to be vaccinated fully or to be tested twice weekly and to be excluded from the setting before transmission has an opportunity to occur if they do test positive.
Okay, thank you. Dr. Byers, I have another question for you. Anna Farish with WJTV. Could you please talk about what happened at St. Catherine's, which we're very familiar with? There was a COVID outbreak there and those folks were vaccinated, and that is true. Dr. Byers, why don't you go ahead and take that?
Well, I can tell you that, our investigation is still ongoing and there's still some pieces of information that we're trying to collect, but we did have an outbreak among residents at the St. Catherine's facility, and these were among individuals who were fully vaccinated. And I think that it's an illustration of the fact that depending on the circumstances, certainly in congregate settings where there's higher level of contact, there can be transmission of the virus among fully vaccinated people. But the thing that I really want to illustrate here is that these were individuals who were fully vaccinated. They are vulnerable. They're in those age groups where over the course of this pandemic, we have seen the highest impact of death and hospitalizations. But the vast majority of these individuals had minimal to no symptoms. And that's an indication of the protective value of the vaccine, even in the event that somebody has a breakthrough infection. And that's why it is so important for individuals to get vaccinated. Not only can the vaccine protect you against infection, but it can vastly limit the severe outcomes that occur if an individual is infected. And that's going to be even more important as we see the emergence of the Delta variant and potentially other variants. The way that we limit the transmission to fully vaccinated individuals as well as unvaccinated individuals is to increase the overall vaccination rate. When we limit the transmission, we limit the risk to both vaccinated and unvaccinated individuals, and we reduce the chance of an emergence of a variant strain. So it's just another illustration that although we had cases that occurred among vaccinated individuals, they had a significantly less severe infection than we would have expected and a significantly less severe impact.
Thank you, Dr. Byers. Shalina Shetlani from NPR is asking how many cases of the Delta variant there are in Mississippi. That's on our website, Shalina. We just updated that yesterday, so just go look, unless you know it off the top of your head, Paul. Do you know
I think we have 29.
Okay, that
Delta
is
variant.
updated. I thank you.
Yeah,
That's updated,
right.
Shalina, every week. You can
And they're
most
by
of
county, so I would
Yeah.
encourage y'all to look at county, but just understand that one of the things that we're seeing with the Delta variant now is the potential that we're seeing community transmission. That means that now is the time to act and get vaccinated.
Thank you. And I think that answers the other question that Shalina had. Kobe Vance from MPB. What threat does the Delta variant pose to fully vaccinated residents, and should fully vaccinated residents wear masks more often to prevent transmission of the variant? Dr. Dobbs, why don't you take that?
Yeah, so we're really concerned about Delta variant because it's so contagious and it looks like it might have a mortality differential with previous variants. Like Dr. Byers said, we're seeing some cases, but we do know it's still protective. It's not perfect, but it's highly protective even if you do get infected. As far as wearing the masks, it's really important to think about in places in congregate settings, where does the virus come from? It comes from the outside. It comes from visitors. It comes from staff members. We have seen outbreaks where symptomatic or asymptomatic staff members brought it into the nursing home that led to cases and deaths. And this is something that just can't be okay. We've got to do everything we can to protect folks who are vulnerable. and it's really going to be that sort of, the entry point for the virus. So, would wearing masks for the residents make some difference? Marginal maybe. We need to get them vaccinated, but really we got to make sure that we block up those entry points for the virus so it can't get into these vulnerable populations.
Thank you, Dr. Dobbs. Shalina, that would be the brown. Vaccine deserts are represented by the brown. Anna Farish, again with WJTV. Do you believe the First Lady's visit yesterday had and will have any impact of folks getting vaccinated in Mississippi? We will take everyone we can, and certainly she is a great presence, and we were pleased to have her in the state. Jim Craig, why don't you say something first?
Yeah, no, I think any and everything that we can do to help encourage Mississippians to get vaccinated is a good thing. And I was really proud to see that she was here to encourage folks to get vaccinated in Mississippi, and to actually show with the younger students, I think was priceless, because, for us to get back to a more normal school next year, it is so important that children that are 12 and over right now go ahead and take advantage of getting vaccinated, and those teachers and parents, just make it a family gig. Come on up and get vaccinated.
Dr. Dobbs, we talked about this earlier. We appreciate the First Lady coming to Mississippi to encourage folks to get vaccinated.
Yeah, and we encourage others to step up and take a stand. Every constituency has a different set of representatives, and this is a all of Mississippi thing. So if you have a leadership voice, please step up and make sure that you're doing what you can to advocate for the benefit of your community.
And I just wanted to add, with the pop-up sites that we are doing, the sites where we go town to town, we are also getting in touch with the movers and shakers in each of those towns, the church leaders, the business leaders, the chambers, anyone that can help us spread the word. So we are counting on those folks to help us get people into the pop-up vaccines. Let's see, Quentin, how many cases? Okay, that is on our website, Quentin. Kobe Vance, there have been several vaccine providers in Mississippi that are beginning to use incentives like free food or gift cards. Do you know if these type of incentives have been successful? And do you have any updates on if the state could offer incentives in the future? Dr. Dobbs, why don't you take that?
Yeah, so we're glad to see some of our partners stepping up and trying to do some incentives to get folks vaccinated. Certainly, it'll move the needle for some folks. How impactful it is overall is hard to say. It's not proven that overall it'll increase the numbers, but anecdotally, it seems like to some degree it is helpful. We have been talking to other states, and they have sort of like a mixed bag of sometimes it seems to help, but probably not as much as we would have hoped. As far as we have severe restrictions on what we can do with our federal money. I mean, essentially, we almost can't do incentives, and so that's kind of limited us going forward. But we encourage people to do it for their own folks. If you guys have paid attention, I'm using my own money to raffle off a Yeti cooler and an iPad for our employees, just as a reward for stepping forward and being thoughtful about their fellow employees and their families. So it's something that's a good thing for people to do. And if you're in a business or a hospital or a nursing home, we encourage you to think about these incentives as an added thing to say thank you, to represent our recognition of the good things that folks have done for themselves and for us collectively. And as far as some of the stuff has been done, that the big things have done mostly sort of with state funds and state money, and I haven't seen any initiatives to use state money for that right now.
Okay, thank you. Michaela with Kaiser Health News. What kind of guidance is MSDH giving K through 12 schools and universities on how strongly they should require vaccination? Should students and teachers mask if the school population doesn't reach a certain level of vaccination? Do some sports activities carry elevated COVID risks? So why don't we start first with the K-12 schools and universities, and Dr. Byers, why don't you take that?
Oh, absolutely. Thank you. And certainly we're giving guidance to schools. for recommendations of vaccine. And just like we've talked about with the K-12 setting, this is going to be an important model moving forward for us to get back to more normal operations in the school and reduce those interruptions that occur. The more folks that we get vaccinated, less chance we have of ongoing transmission, and the less risk we have of interruptions. And as far as mask use in the schools, right now CDC currently still does have guidance that recommends universal mask use in the schools regardless of vaccination status. And right now we are adhering to the CDC guidelines. We anticipate new guidelines coming out soon as we get through the summer. And certainly once we receive those, we'll take a look at them, and we will be sharing those with the schools in Mississippi and making sure that they understand broadly what the new recommendations are, whether it's based on vaccination or not, as far as mask use. So we're waiting to see what that's going to look like. And as far as, are there sports and other activities that we've seen other higher risk of transmission? Yeah, we've saw that throughout the year, that often the extracurricular activities, the sports were our weakest point in the school, and that's typically where we saw a higher level of transmission than we did when kids were sitting in a more controlled, static environment in the class and staying spaced and wearing a mask. And a lot of times those measures break down more in a sports activity or an extracurricular activity, especially when folks are not wearing masks, and especially when the kids are not vaccinated. The more kids and teachers that we get vaccinated, the less of a risk of transmission those sorts of events are going to be.
Okay, thank you. And I mean, speaking of sports, Jim Craig, you're a father of 10 children, is it? No. But, we want kids, parents should want their kids to be vaccinated too, because really it will keep them in school longer and keep them in their after school activities. And I was just going to ask you, as a father of so many, how important that is in maintaining life.
It is, and extracurricular activities is a big part of school, and we get that. And, making sure that people are vaccinated, especially when they're going to compete with other teams from other parts of the state. And, a lot of these sports are close contact, even banned. It's an opportunity for a lot of community transmission. So getting everybody vaccinated, it's easy, it's safe, it's just time to do it.
Thank you, Jim. Matt Williamson from the Enterprise Journal will soon be hitting the 6-month mark since people first started receiving their vaccines. Is there a definitive answer about the need for booster shots? If so, what will the scheduling of those look like? Let's first start with Dr. Dobbs, and we'll go to Dr. Byers and then to Jim.
There's no indication that for most folks a booster shot is going to be needed. The immunity seems to be pretty robust, longstanding, and keep in mind that it looks like the vaccine immunity is better than natural infection by most measures. But there may be some subgroups, and this is something I want to really reiterate. We know that certain people, cancer patients, transplant patients, people on immunosuppressive medications, which is a lot of people, do not have a good response to the vaccine. And, this is the one group of people that I think doctors may want to check antibodies for to see if they're immune, because these folks still need to be careful. Because the rest of us haven't gone forward to protect us as a community, we've done a me first approach. We've left these people sort of out at risk on their own. So that group of folks may benefit from a booster. There's some, ongoing data that's showing that people who didn't have a response to the first vaccine, there may be some additional doses that may, get them over the hump. As far as like the general population, there's really nothing that shows that it's going to be needed right now. Certainly, if we have a major shift in variants that sort of threatens us, that would change the conversation. But just with the variants we're seeing, there's no really clear indication that that's on the horizon.
Dr. Byers?
No, I was just going to say essentially the same thing. I mean, I think if we see some variants that emerge that are escaping the vaccine, that may be an indication of the need for boosters, or if we see evidence of waning immunity before we can get over the hump. And there's been no data that supports that immunity is waning at this point. I think And as Dr. Dobbs said, there may be, groups of the population where a booster may be recommended at some point. But I think we're just going to have to kind of wait and see the way things look before we get too far down the road on boosters.
And Jim, I know you would be able to schedule those just as well as you scheduled everything else.
Well, we would do the things necessary to get a booster provided in Mississippi if that's the need. But I think the real important message here is that if we can get more people in Mississippi vaccinated and throughout the country, then the hold these variants will have on us will be much less. So again, get vaccinated so that we can help control variants and help protect each other. It's just part of the message.
Okay, thank you. From Josh Wingrove, who is with Bloomberg News and is driving right now on the road, so be careful. How are your folks feeling at this point? Cases are low, but Delta is spreading and vaccine coverage is low. Are you worried? What's the sum of this? So you might have come in a little late, Josh, but we're very concerned about the Delta variant. Paul, quick word.
Oh yeah, absolutely. I mean, we're in a better spot now than we've been in a while with lower cases, lower deaths, and that's very encouraging. I think the Delta variant and other variants at this point are sort of an unknown quantity. We know that there's going to be transmission. We don't know how much that's going to impact the overall case numbers or what that's going to look like with our hospital or healthcare capacity and what impact it may have on that and what impact it may have on deaths. But certainly that's something that we are concerned enough to want to continue to watch it. And I think that just adds to the recommendation that now, before we get to that point, before we get to a point where we see increased cases again or increased pressure on our healthcare capacity, that when it get vaccinated now, don't wait until that cat's out of the bag again.
Okay, thank you. And Josh is also asking, he says, you folks have in some ways some of the bigger challenges as public health leaders, given low vaccine uptake in the state and across much of the South. No easy task for sure. Why do you think that's the case? What factors are driving the low uptake across the region? Thomas, why don't you, Dr. Dobbs, you go ahead. We did talk about this, but Josh is on the road and he may have not heard some of this.
And as a little bit of deeper dive, we knew that it was going to be a difficult path for the South because we do have this embrace for a culture of illness. If we had a medication that had 1,000 times higher side effects than the vaccine, we would take it when we're sick, but we won't take a very highly effective vaccine because we don't have a preventive mindset. It's something that's really kind of a challenge for us, whether it comes to breast cancer prevention, cervical cancer, heart attacks, strokes. Getting ahead of the curve has been a real challenge for us for a whole host of reasons. And, something that's a foundational problem. There's not a catchy jingle or a messaging that's going to shift that. We can hit some folks and save some lives, but it's going to be a structural change that's going to make a difference for us going forward if we really want to, kind of get over this. Same social determinants of health, poverty, education. I will say one thing, though, that unfortunately politics has muddied the water on this. COVID is science. There's nothing political about breast cancer, heart attacks, and there's nothing that needs to be political about COVID. It's a virus that's killed over 600,000 Americans, and we have a tool to prevent it. That's just and we have a safe and effective vaccine. That's the bottom line. And as apolitical public health professionals, we're going to do all we can to get folks protected.
Thank you, Dr. Dobbs. Dr. Byers, do you have any comments about that?
No, I think Dr. Dobbs is directly on point with where we need to be.
Okay, thanks, guys. Okay, I do not see any more questions, so we'll do the roundabout. Dr. Dobbs, I'm sitting at home. I'm pretty apathetic about getting the vaccine. The case numbers are low. What's the one sentence you want to say to me?
You have a choice. You get the vaccine or get COVID. Vaccine effects and effective, and COVID's killed over 600,000 Americans. The choice is easy. Protect yourselves, protect your family, protect your community.
Okay, Dr. Dawes, maybe we should issue a challenge to the counties to see if they can get up to the 40% vaccination rate. What do you think about
I would love it. Consider it so issued.
that? Dr. Byers, you start working on that, okay?
I'm on it.
Okay, Dr. Byers, one sentence to get healthcare workers to get vaccinated. We see it's critically important in the long-term care facilities. One sentence, we need our healthcare workers taking care of the vulnerable to get vaccinated.
Most healthcare workers that I know who are dedicated and have chosen to work in that profession would do almost anything for the well-being of the individuals that they take care of. This is just another one of those pieces. You don't want to be the source of transmission for those patients and residents in long-term care settings that you're taking care of and that you care for. So now's an opportunity. You would do this for your family. Most of us would do anything to prevent illness in our family. We need to do the same for those individuals that we are charged with the care of.
Thank you, Dr. Byers. Jim Craig, as the gentleman with the most children, although all of you are parents, what would you say to parents about getting their kids vaccinated? It will mean less disruption for parents and children. Talk a little bit about that.
Yeah, I really think, we all long for life after COVID. And I'm right there with you. The kids are, everybody is. What can help us get there is to get vaccinated. And again, it's safe, it's easy. We have opportunities getting closer and closer to Mississippians all the time. So take the opportunity, get your children vaccinated. As the parent, lead by example. Get vaccinated and encourage them to be vaccinated as well if you're not already vaccinated. But it'll make life a lot easier for our school year next year, for our extracurricular activities, and for our state. So it's just too easy to do. You look at the numbers today, and we have 14 Mississippians on a ventilator with COVID in Mississippi, and we have a vaccine out there that can just about almost 100% keep that from happening. So why not take advantage of it? Why take the risk of being one of those that end up in a hospital, end up on a ventilator, or end up dying from COVID? We have an answer out there. We just need to really take advantage of it.
Okay, thank you, guys. On behalf of Dr. Thomas Dobbs, Dr. Paul Byers, and Mr. Jim Craig, I'm Liz Charlotte, thanking you for tuning in, and we'll see you next time. Have a great afternoon.
Thank you.